Hi, everyone. Thank you for coming back to us. So I'm Hélène Decalvé. I'm a pediatric immunologist and clinician scientist at the CHU Saint-Justine. And I'm going to co-chair this session with Audrey-Jeanne Baudouin from University of Sherbrooke. So we're really happy to receive today for our keynote speaker, Mamta Gautam. So Mamta Gautam is an internationally renowned psychiatrist, consultant, certified coach, author, and speaker. Focused on physician health and well-being since 1990. She's a pioneer in this field, and she's also known as the doctor's doctor. Dr. Gautam is the founding director of the University of Ottawa Faculty of Medicine Wellness Program. She also served as the expert physician advisor for the Canadian Medical Association Center for Physician Health and Wellbeing, and she currently chairs the Burnout Task Force at the Ontario Medical Association. In the past two decades, she has expanded her work to include physician leadership development to better address system-level factors that impact physician wellness. All of her educational, clinical research, and administrative work aims to promote physician health and develop physician leadership. She has created podcasts and videos on this topic, and she authors articles, book chapters, and 2 internationally best-selling books. She also brings this knowledge and expertise to Peak MD, through which she delivers keynote presentation and workshops, counsel to healthcare organization, and coaches senior physician leaders internationally. She is deeply committed to advancing diversity in medicine and leadership development for women in medicine. She has served as the diversity monitor at the Royal College of Physicians and Surgeons of Canada. She has developed and co-leads Momentum, a 6-day retreat for women in medicine. And she recently founded the RAFT, an online platform for leadership development and community for women physicians. She's the recipient of numerous prestigious awards for her innovative work to support her physician colleagues and for her mentoring of women colleagues. And she has also been awarded distinguished fellowship in both the Canadian and American Psychiatric Association. So I'm really happy that she accepted to come and give our keynote speech today. She's going to discuss about leadership with us, and I know she is going to be very interesting. So I welcome you, Mamta, and I give you the podium.
Thank you very much, Hélène. I really appreciate your kind words of welcome and the kind introduction as well. I very privileged to be a part of this annual symposium here today, and really admired the organization with your vision of training future leaders of child health research. And I'm going to just take a minute to share my screen so I can bring up my slides for you. And what I was asked to speak about as the goal is training future leaders in child health research is about leadership skills. And of course, you know, I could have you for a whole year and not finish all the things I want to talk to you about in terms of leadership. And my hope is that, you know, we'll be able to hit on a few key points that will allow you to pivot and continue on from there. So we're going to focus today on what makes a great leader and think about some key skills for maximizing leadership potential, regardless actually at what stage of leadership and what stage of training you're in at this point. This is my disclosure slide. As Hélène told you, I have a small company, Peak MD, through which I do some keynote presentations, some healthcare consulting work, and coaching senior leaders in healthcare. I did do a couple of presentations for Amgen and Merck back in March of 2020 as the pandemic was coming upon us, but there will be no potential bias to mitigate today. I would like to take a minute before we start to honor traditional territory. Although this meeting is occurring virtually with modern technology, each of us is located in a particular place with rich history and traditions to honor. I'd like to acknowledge that the land from which I join you here in Ottawa is the traditional unceded territory of the Algonquin and Anishinaabe people. I'm very grateful to have the opportunity to be present here. I invite each of you to take a moment and consider and honor the traditions of the territory from which you are joining us today. So we have some lofty learning objectives today. We're going to talk about leadership, defining what leadership is, and identifying some leadership frameworks in healthcare. I'm going to look at the value of emotional intelligence as a leader. Also think about, are there some gender differences in leadership skills and perhaps gender inequalities in leadership positions in academia? And then we'll finish with the 3 key capabilities of leadership. So Kouzes and Posner, who've written really a seminal book on leadership, talk about leadership and define it in this way. They say the mastery of the art of leadership comes with the mastery of the self. So ultimately, leadership development is a process of self-development. And if I put this into context, we see at the very bottom, almost foundational, is understanding ourselves, right? Where we gain awareness and insight of how our personal style, not just what our personal style is, but more importantly, how it impacts our relationships with other people. Once we understand ourselves, we're better able to build constructive one-to-one relationships, which involve engaging others, communicating effectively, listening as well as speaking, and feedback. That we can move from one-to-one relationships to leading teams and helping team members reach agreement about how we're going to move forward in the most productive way. And ultimately, that will help us transform organizations, moving several teams to commitment and looking at how we can do things continuously in innovating and in a more effective manner. There are a couple of frameworks in healthcare about leadership. And although, a lot of my work has been done with physicians, we certainly have extrapolated this to other leaders in healthcare and, scientists in the area of healthcare. So I'm hoping that, this will be applicable and relevant to all of you. The LEADS framework is a framework actually made in Canada, so very proud of that, at Royal Roads University in British Columbia, and it defines the capabilities of leaders in healthcare. So the L stands for lead self. The E is engage others, the A is achieves results, the D is developing coalitions, which leads to system level transformation. And while started in Canada, this framework has been adopted in many countries around the world. And one of the things that really helps it stand out is the D, the developing coalitions. A lot of leadership frameworks really look at the leader and how they interact with people around them and perhaps lead a system, but the ability to develop coalitions, which is a critical leadership capability, is not one that until the LEADS framework has been well outlined or defined. I also wanted to show you, for those of you who are physicians, that that this LEADS framework maps very nicely onto the CanMEDS roles, which defines the roles of physicians in their multiple areas of interest, both at the College of Family Physicians as well as the Royal College of Physicians and Surgeons in Canada. And what the CanMEDS role does is puts the medical expertise firmly in the middle. So that's what you need to have that grounds everything. But then we see these other roles, such as being a health advocate, being a scholar, the professional communicator role. We look at the role of being a collaborator, and then looking at the leadership role. So you can see that that leadership role is very much one of the petals of the CanMEDS framework. So when we think about leaders and what helps them, one of the ways we look at is when do they start to fall into trouble? And two of the key pitfalls for leaders that have been defined over and over again and consistently over decades are these. The first is rigidity. Leaders who are unable to adapt to changes in the organizational culture or to take in responding to feedback about the traits that need to change are going to have difficulty in terms of their leadership roles. And poor relationships. right? And sometimes the poor relationships part actually comes from being rigid, but in having one way to do it, some leaders sadly will alienate people that they work with, and sometimes the feedback that they receive is that they're just too critical, too insensitive, overly demanding, sometimes untrustworthy. But basically, it's just they push too hard, and that's something that a lot of us in our perhaps in looking for perfectionism and trying to do things the right way, in the most time effective way, in the most efficient way, in the most productive way, we end up just pushing everyone along at the same rate that we would want to go at, which sometimes can make it difficult for leaders. And this is really important for us to understand these two things, because these are all things that we can work on, right? These are things that if we can understand, we can work to modify. And think about every single person on this call, and you think of all the things that you have learned. This is about adopting a learning mindset and realizing, even if this is not sort of my area of expertise, or even if I don't feel like I'm at the peak right now, I have everything it takes to learn, right? So that's what we want to move forward with. At the end of the day, if I'm walking along and I look back and I'm a leader and I look back and there's no one following me, am I a leader, or am I just out for a walk, right? So I want you to be thinking about how can you really fulfill the concept and the role of being a leader. Emotional intelligence is going to be a big part of that. This is the ability to understand, to use, and to manage your own emotions in positive ways. And so we recognize that the IQ, the actual cognitive intelligence, is a huge part of what got us here. Right? But what you're going to see that for leadership, we see that the leaders that have a higher level of emotional intelligence actually end up being more effective leaders and end up actually having more satisfaction in their role as leaders. So why is emotional intelligence so important? It's important because you can then use those emotions in intelligent ways, in positive ways, to relieve stress, to communicate better with other people, to empathize with others, helping people overcome challenges, and to manage conflict more effectively. So here are the 5 components of emotional intelligence. Daniel Goleman outlined them in an article in the Harvard Business Review many, many years ago, and continues to work in this area. He talks about, the importance of self-awareness, but not just knowing what I'm like and when I'm emotional or what my feelings are, but then to regulate them, right? So we need to not just have that awareness, but to be able to monitor and modulate our emotions so that they're appropriate to the situation that we're in. We need to have some sense of internal motivation, but also an external sense of empathy where we care about the people that we're working with. We can understand what it's like to be with them in their shoes, and all of that requires a high level of social skills as well. And this is probably one of the critical or foundational leadership lessons. It's what I call the awareness gap. That, there are times, and this is where the emotional intelligence helps us, but there are times where what we say may not be what was heard. And the more emotionally intelligent you are, the more you can bridge that gap. And so what you actually meant to say is closer to what they heard. Here's the reality as a leader. We judge ourselves by our intent, but others judge us by our impact, right? And so the more we appreciate that, the more we recognize that, the better we're going to be able to make time to listen to what people are saying and to make sure that we are as clear as we can so that the gap between intention and impact is much less. Okay. So does gender matter in terms of leadership roles? I'm going to just cover this large area in a fairly short period of time. Happy for you to have the slides if you want to go back and look at some of the references. Back in 2012, McKinsey & Company, who've done a fair bit of work in this area, looked at unlocking the full potential of women at work. And what they realized was that women make up 14% of Fortune 500 executive committees and few women CEOs. And even though this is almost a decade ago, the numbers have actually not increased that much. And what they also showed us was that there's lots of benefits to gender diversity at the leadership level. It helps to create open, accepting, inspiring culture, generates stronger business results, and fuels creativity and emotion and innovation. The bottom line, women are good for business. And, you know, multiple studies summarized on this slide where we look at, if we just look at leadership effectiveness, we see that women over 40 were felt to be more competent leaders than males over 40 based on 360-degree feedback. We see women CEOs delivering 3 times the returns, higher profitability, greater client satisfaction. We see companies that have women directors on boards with much greater returns on sales and higher return on equity. And so, you know, so we look at any of these very, you know, concrete financial measures, and we see that women are good for business. Let's look at women in healthcare and women in medicine. I have to tell you that I don't have all of the data. I did look for some, but I wasn't quite sure of you know, exactly all of the different healthcare workers in on this call, and to get the data for all of the specialties. And so, with apologies, my understanding is that, you know, what we're seeing in medicine is really parallel, really aligns well with what we're seeing in other specialties in healthcare as well. We have seen that women physicians and women in healthcare generally are changing the face of healthcare. 1997 was the first time that there were more women than men in first-year medical school, and now we see about 50 to 70% of the first-year classes made up of women. We see that, you know, fast forward then to 2017, 41% of practicing physicians are women. And by 2025, we extrapolate that it'll probably be more than 45%. And we have some good data on how women are not just, there are more of us in medicine, but that in fact, you know, how we approach patients, how we communicate with patients, how satisfied patients are with our care, and the patient outcomes are all different and for the most part improved. Yet, even though we have more women in medicine, women physicians in leadership roles continue to be underrepresented. And again, we see that with other healthcare professionals as well. For example, 1999 was the first woman dean at a Canadian medical school in Canada after 175 years of medical school history. And currently, and I've listed the ones that have followed Dr. Noni MacDonald, currently we have 4 female deans of the 17 medical schools. We look at CMA presidents. Again, CMA founded in 1867. It took 117 years before a woman was elected president of the Canadian Medical Association. There have been 9 to date, and our president-elect is also female. Medical schools in Canada, right? We look at 37% of full-time faculty members are women. And we see 61% at the instructor level, but then when we look at assistant professor level, we're down to 45%, even further down to 37% at associate professor level, and 22% at the full professor level. Let's look at CIHR funding data for these 15 years from 2000 to 2015. We see the average length of funding grants for women is less, 2.5 years versus 3.2 years, and the grant size as well, right, is much more reduced for women than men. So why is this? And there have been lots of reasons proposed, and you know, hope that this is certainly not a full list, but just getting us to think about some of these things and hopefully sparking some of the discussions to recognize that really what we're looking for is better representation, so that, you know, what we see as a proportion in leadership is really reflective of the general membership. Some of the reasons have been cited to date: gender stereotypes, where we look at you know, unconscious assumptions that people have and how that might negatively influence decisions regarding promotions, regarding, having regarding sort of applications being accepted to certain positions. And all of this is this assumption that perhaps the women are not as well trained or may not be as interested. But it's really important for us to understand what these assumptions are. We're looking at more and more the implicit biases that are present and looking at what we can do to acknowledge and then balance these more clearly. There are manifestations of sexism, both subtle and explicit, in the medical environment. And sometimes they're very explicit and we're just told, that, we already have enough women in this training program. Sometimes they're more subtle. I remember going to my department chair many years ago for that annual performance review. And I sat down and I waited for him to speak. And he said to me, he goes, "Oh, now I understand how you can help so many of our colleagues, right? You just look at them with your big brown eyes and they must instantly feel better." And I'm sure that he didn't dismiss, right, the clinical skills of any of my other colleagues in a similar manner, and perhaps even meant that to be a compliment, except that, it was a subtle form of sexism. Over the years, women have lacked effective mentors and role models, for the work that they're doing. This organization is a great example of what we're doing to move past that. But at times, there's still a sense of isolation and exclusion as we move forward. And then there's the culture of the organizations, right? Which is, again, where I think the mentors help us a lot, because there's a whole labyrinth. Like sometimes you don't really know, how do you get further ahead in this department or in this division or in this hospital or at this university? What are the barriers and what is that route through? And sometimes it's not clear. And sometimes people know, but they've never really articulated it. And so unless someone shows you, you don't really know kind of which are the committees that if you serve on are, the ones that are going to make you more visible and help you into leadership roles, and which are the dead end committees, right? So good for us to know that. There is a glass ceiling for women leaders, the sense that that basically, you can continue on, but you can only get to this far. So as we look at some of the data, say about promotions, that, maybe for some of us, the glass ceiling is going to be at the associate professor level, and we'll have to push beyond that to get to full professorship. And the glass cliff, right? This is a new concept as well, where, again, it's not as visible, but basically there's a cliff, after which or at which point we fall off. And what this refers to is there's a lot of times where there's a really difficult situation. Sometimes there are relationship issues or behavioral issues or some kind of conflict, and then a woman is actually given a leadership role to try and smooth that out. But we know that in many ways, this was going to be a no-win situation, and the female leader is actually set up to fail and goes over that, that theoretical glass cliff, right? So these are parts of the things that women have experienced that are important for us to look at. More importantly, so that we can look at how we can move past that. And there is an assumption that women might prefer to focus on family over career, and yet studies show that that's absolutely not true, that women are equally interested and equally qualified and equally skilled. I will often tell colleagues that, you might take a little bit longer to get to where your male colleagues are at, mostly though by choice. If we choose to have children, then that's going to be our priority, and that's what we want to focus on. And it may sort of detour us for about, say, 5 to 7 years, but then we're able to get back on track. One of the things we need to look at, though, as we look at some of the criteria for awards or grants or promotion, is to make sure that we include that, so that, if a female colleague is taking 7 years to have children, and I say to people, basically life begins again when the youngest is 4, right? So when they're in school full time, then you can get back to, sort of on that academic track. If we have awards, if we have competitions, if we have promotion processes that are all about that first 10 years, then, it may not be fair for women that have these competing priorities. So something for us to keep in mind. Overall, though, we're not really talking about men and women. We're talking about ways of thinking, of beliefs, of traits. And the world is becoming increasingly social and interdependent. And some of the more traditionally feminine values are ascendant. So what we're looking at are in leadership roles, starting to value traits that are more flexible, that are more collaborative, that are more nurturing, that emphasize cooperation and long-term thinking. And this is a lot of what we saw, for example, in the last year and a half through the pandemic, that as the leaders, rose up, and the ones that did well and the ones that were, I think, well regarded, but also the ones whose countries did well were the leaders that were seen as being more collaborative and flexible and nurturing. So what are some of the key capabilities for leaders? And so there's an article by McKinsey and Company that defines 3 key capabilities. The first is a level of confidence, right? Some self-assurance coming from an appreciation of your own abilities and qualities. The second is grit. That resolve, that courage, that ability to, come back and do it day after day after day, what allows us to have that. And then thirdly, a sense of resilience, which is the capacity to recover quickly from difficulties, like having that mental toughness, because we know that those difficulties are actually going to happen. I'm going to talk about each one fairly briefly. Let's look at confidence to start. So confidence is all about self-belief. There's a great book called The Confidence Code. I've referenced it down at the bottom of the slide. And a great quote from that is, when we lack self-belief, we cannot turn our desire into action. And so this is really the important part of confidence. It's not so much that, it's not so much that not having confidence is a problem. It's because sometimes, we can have it, or we cannot have it, but we can fake it. And that's okay. Because at some point, that faking it till you make it actually does work. The biggest problem with not having self-belief is that it basically leads to inaction. Right? So if I don't think I can do this, I don't apply. I don't apply for that award. I don't apply for that funding. I don't apply for that position. I don't apply for that academic promotion because I don't have the confidence. And so it's that inaction that actually leads to failure, right? So what we really want to look at is, how do we turn that desire into action? So confidence is all about taking action. And what's very interesting is that studies over and over and over show that success as a leader correlates more closely with confidence than with competence. Now, you have to be competent, right? But if we look at people who were equally competent, equally qualified, equally trained, the ones that had the confidence to go along with it actually were able to succeed beyond their peers. What's also really interesting is that, for everybody on this call, the competence is not an issue. And, over the years, I've been certainly quoted as saying all sorts of things, and some I'm more proud of than others. But really, the one that I'm really the most proud of is a quote that, urges all of us to, increase our level of confidence to match our level of competence, right? I really believe that in healthcare, we need to be looking at that, because it's that belief in our success that stimulates the action. And then it's a bit of a positive feedback loop, right? That we take the action, and then we, have a good outcome that helps build our confidence and helps us to continue to take action again. Very important to remember that that action is all about repeated attempts. It may not work the first time we try it, and that's okay, right? It was worth a try, because it was all about calculated risk taking. We're not just taking wild risks, we're doing it in a very calculated way, and it really involves changing the way we think, changing our mindset so that we can reach out, we can try something different, we can stretch to a certain extent, which would be really helpful for us. What's going to be very important is the concept of failing fast. Right? All of us in healthcare are, are highly responsible, are mostly, perfectionists, right? And this concept of innovating and failing fast requires us to be more aware of that, to recognize and to stop trying to be so perfect and actually being prepared to fail, because failure is inevitable. Right. And, it's not something we talk about very much in healthcare. It's not something we talk about very much in society overall. When we look at social media, it's all about, the amazing things that have happened. That's what we end up posting. That's what we end up talking about. That's what we end up rewarding and celebrating in our culture. But really, failure is inevitable. And what matters most is how we fail. So what I want us to think about is the concept of failing fast. So, I'll share an example with you. I, a few years ago, was encouraged to run for the role of president-elect for the Canadian Medical Association. So it changes, it goes through different provinces. This was the year that Ontario was going to elect the president of the Canadian Medical Association, and all the other candidates, there were three candidates who had stepped forth. There was not a female candidate. So the Federation of Medical Women of Canada asked if I would agree to be nominated so that we had a female on the ballot. So, made sense to me as something I support and encourage. And so I thought, I need to do this. So I, step up. Now, for me, this was a huge stretch. Right? It was totally out of my comfort zone. I'm really not interested in sort of the publicness of it, the election part, the having to campaign, the having to ask for votes, just come from an environment where if you just do the right thing, you hope people will notice and reward that. That's not how it works when you allow and set yourself up for an election. Anyway, so worked hard, did what I could. Long story short, I didn't win. I came in second by actually just a handful of votes. But, second is not winning the election. So I get the phone call and I'm at home and I sit down and I'm thinking, oh my gosh, right? Like I failed. So I made myself a cup of tea. I had a little cry and I called my mom. Now, my mom is amazing. So she, knew exactly what to say to me. She said, listen, are you happy, that you did this? And, it was a big stretch. I learned a lot. And I said to her, yeah, you know what? I did learn a lot. I'm glad I did this. She said, do you feel like you did enough? Would you have, did you not do enough? Do you think you could have done more? And actually, I was probably the only candidate that showed up to every debate and every event and every meeting. So I said to her, no, you know what? I'm not sure I could have done anything more. I gave it my best. And then she said, well, do you think you made a difference? And, I had suddenly started on social media. I was talking a lot about healthcare and teams in healthcare and the importance of wellness of healthcare professionals. And suddenly it was all sort of back, in our conscious awareness. And I said, you know what, I think I really did stimulate a lot of conversation and discussion about wellness in medicine. So I said, yeah, no, I think I made a difference. She goes, well, then you know what? You didn't fail. You succeeded, right? Let's move on. And it was just that whole idea in this 15-minute conversation that I was able to look at that, have my reaction, whatever it was, but then recognize that was important, that was worthwhile. I learned something from it, and then I can turn the page and move on. That's failing fast. I want each of you to think about how you can do that. Like the whole concept of failing fast is the ideal paradigm for building confidence. Because if we can just embrace failure as normal, this is just part of forward progress, then we can actually do, spend more time on mastering what it is we need to do. Also important to remember that part of what helps us build our confidence are these cycles of trial, responsibility, and success. Right? So we have to try things out. We have to take responsibility, and that actually exposes us to adversity, which allows us to toughen up a little bit and build our confidence. And again, those of you on the call who have some leadership roles, who have, feel like you have the ability or the confidence to reach out for things, are probably people who have been given early responsibility. Right? You were asked to do something at a very early age that you took on. And yes, it involved taking a risk because it was something, you might not have been fully ready for or fully trained for. It was just what you had to have, you had to do. And perhaps it involved having some failures. But in fact, the more we do that, the more likely we are to be able to build our confidence. And certainly, as I look at that, there is this sense of, I can do this, or at least I know I can learn. And so what we're talking about is what Carol Dweck defined a growth mindset. And so we look over on the right-hand side, a fixed mindset, which basically tells us that failure is the limit of our abilities. I'm either good at it or I'm not, and I don't really want to be challenged. And, if I get frustrated, I'm just going to give up. And I just want to stick to what I know. But remember that that's the known, and that is currently where I am. It's it's our comfort zone. And what we need to do as we move out or as we stretch out of our comfort zone is to stretch out of this fixed mindset into what's called the growth mindset, where we start to see failure as an opportunity to grow. Where we see that, if we're challenged, that just helps me grow, and it just helps me feel more confident that I can learn to do anything I want. That feedback that I get from others is constructive. Other people's success is actually inspiring to me, not defeating. And I like to try new things. So moving from where I am now, that sort of comfort zone, to a zone where everything is totally brand new, in between that is this stretch, right? So we don't have to just leave and go right to something else. We can just stretch out of where we are now, out of our comfort zone. In what we're going to be ending up with is in a zone of learning, right? A zone of growth. So that's what I want you to be thinking about. Part of, just to reframe and to put them all together for you, some ways to think about changing and boosting confidence is leaving that comfort zone, right? Stretching from that comfort zone into the learning zone. I remember as I prepared to get ready for the CMA elections, I remember telling a couple of colleagues, I'm not sure, like, this is totally uncomfortable for me. I'm not sure I'm ready. And I remember one of my colleagues, Bob, saying, Mamta, comfort zones are highly overrated, right? And so really important for us to recognize as we move forward, just that this is actually what we need to do. And we need to, allow and do it slowly, but that's how we grow. If you do get negative feedback, don't ruminate about it, rewire it. Think about, how was that helpful to me? How can, what did I learn from it? And remind yourself, then that was worth it because it was a good learning process. The NATs are negative automatic thoughts. We all have them, right? Just our own mindset about ourselves, the stories we tell ourselves about, you can't do it, I'm not sure that this is the right thing for you. Recognize those, right? And what we're talking about really is cognitive therapy. There are times where we will feel that, and I'm not going to tell you stop feeling that. It would be nice to kill them entirely. I don't know if, what you'll find is that even if you don't kill them entirely, what you will do is learn to balance them more effectively. So I can have this thought that says, I don't think I can do this. And then I need to balance that with, but those two other times I did try and it worked really well. Sometimes it helps to go from me to we. So I'm not doing something for myself, but maybe I'm doing it because, this is what's going to help my lab or my department or my organization. And then that's worth it. Getting that feedback, remember, it's not personal. And I have to remind myself, honestly, I'm just not that important to that person, right? They just give me feedback, then they move away and they forget about it. And I get to decide just how long I hold on to it. So I take what I think is useful and then I move on. Part of being confident is starring in our own production, which means, identifying what our strengths are, identifying what we do well and sharing that and promoting what we're able to do, promoting achievements that we've had so that, that gives us confidence, not just to do it, but to share that with other people. The repeat, it doesn't always work the first time we try something, but if we can learn from it, it's worth repeating again and again. And then finally, speaking up, right? It's important to remember that we always have something of value to add. And part of what helps us boost our confidence is to open our mouth and speak and to share. So that might mean, deciding that when you're going to be at a meeting, every meeting you go to, you might actually say one thing that's important, that's useful, that's succinct, that's relevant, but decide you're going to speak up. If you go to a conference back, when we have those again, just decide every day I'm going to go and I'm going to meet 3 new people that I haven't met before, and just walk up to them, decide, in advance what my script or my elevator speech is going to be, so I know how I'm going to introduce myself, but I'm going to go out and meet 3 new people every day. So trying some of these, just allowing you to stretch and gain confidence. The second one is grit, growing your grit, right? The endurance is really important here. And Angela Duckworth, author of Grit, reminds us how important this is. When a child learns to walk and falls down 50 times, he never thinks to himself, maybe this isn't for me. Right? This is going to happen to all of us. We are going to fall down, not just once, but multiple times. And the assumption is that's okay. This is how we learn, right? Not maybe this isn't for me. So how do we just accept this and have the grit to pick ourselves up and try it again? So part of what gives us the grit is remembering why these things are important to us, how they relate with our passion, our purpose, and then how we progress from that. So let's talk about passion, because it is embedded in the work that you do. Passion is really a collection of your life experiences that give you that deep sense of fulfillment. It's what separates good intentions and opportunism from real accomplishment, and really helps us unlock our potential. So is it real? Is it just, can we all work to our passion, or is this only something that we can do when we actually retire? The reality is you can do this now, right? How do you find it? This is what you do. You want to ask yourself, why do you get up in the morning? Right? You want to ask yourself, how can you leave the world a better place than you found it? What's your legacy going to be? And the work that you do, how is it based in the foundation of something that you're passionate about? And then once we have that passion, how do we match it to our purpose, right? And what we realize is that leaders who create extraordinary new possibilities do so because they're passionate about their mission and tenacious in the pursuit of it, right? So once we decide the passion, that why, what is so important, then we can move forward to looking at how can we do this in a day-to-day way that fulfills this. So starting with the why, this is from Simon Sinek, who talks about how important the why is at the very beginning, which will allow us then to move on to how do we do this and in what way. So what do you need to feel, what do you feel strongly about the need to achieve something? You think about, the work that you do on a day-to-day basis in terms of child health research. Why is that so important? How does it align with your values? And then what are you going to use to get there? Let's talk a little bit about values, because values, just like passion, are really important to create the foundation, that springboard from which we're going to, continue our work on a daily basis. So for leaders, it's important for us to identify what is that we care about the most. The things that we believe in are going to be very important, not just in how we live every day, but it shows up in our work as well. It helps determine our priorities. It's kind of like our inner compass as we look at what do I want to do as I move forward. Honoring our values is critical because it fuels our motivation. It commits us to the action, right? When you think about what do I want to achieve this year in my research, or where do I want to take this, or what's my 5-year goal, this will be part of what will help you define that. But then once we define it, it enables us to act with integrity. It helps people trust us because they understand what motivates us and what's important to us. It undermines the work of that inner critic, or that sort of the, that voice inside our head that says, you can't do it, right? When we realize, yeah, but this is so important, it's part of my values, that helps to balance that out. And then, what we do certainly feels more fulfilling. And then once we've got the passion, we've got the purpose, we need to build on this and have some progression. So recognizing what our strengths are as a leader, thinking about what you need for career growth. And we're going to talk in a minute about supports, Who's going to give you some feedback, and how are you going to continue to seek the new skills and knowledge that you need, right? So your resources, who do you want in your team? As I go through this list, I want you to jot down, if you can, the names of a couple of people that come to mind, right? So for sure, there's going to be a network of peers, right? People that do the same kind of work you do. That's what this organization is all about, bringing you together so that you can share ideas, you can support each other in this. Thinking about who is going to be a mentor for you. And a mentor is basically a trusted advisor, someone who's been there, who can help guide you, who can say, this is what I did to get there. Maybe you want to try that. Now, remember, some places have formal mentorship relationships, and that's great. Sometimes they're informal. You just sort of see somebody that you think, they're doing the kind of stuff I want to do. Reach out and ask them to be a mentor. The one thing I say about mentors is mentorship is not like a marriage. You don't have to be monogamous, right? Have as many mentors as you want, all of whom are there to help guide you and help you become, the professional you can be. Sponsors are somewhat different than mentors. As they say, mentors guide you and say, this is what I did. Sponsors actually will take you into the area that you want to go. So it's almost like there's the door, and mentors say, that's the door I walked in. A sponsor will actually take you through that door. So instead of saying, hey, you should think about, serving on some committees, a sponsor will say, hey, you know what, there's an opening on this committee and I'd like to nominate you for it, right? Coaches are also really helpful. What they do is, perhaps if you have some very specific behaviors or skills or techniques that you would like some coaching on, they're able to allow you to do that. Coaches are, so sometimes they're skill-based, sometimes they support wellness, sometimes they help you as you're thinking of a transition and guiding you through that. I also want you to think about an advisory group. Just like a corporation has, a board of directors, who's on your own personal board of directors? And think about people who over the years have inspired you, who perhaps said something that was really relevant or that really resonated with you. You don't want to overuse your board of directors, but when you're making some major changes or major decisions, you may want to reach out to them either all together or one at a time to advise you through that. And of course, don't forget the importance of your family and friends. We're just going to talk about that in a second as well, as we talk about resilience. I know that you have another session in this conference on resilience. So I didn't want to spend most of my time on this, but I just will wrap up before we finish by just telling you a little bit about resilience. And as you go through that leadership resilience presentation, I want you to think about resilience as sort of temporal, right? Before, during, and after. Before, where, even before you're in a stressful situation, do you have the skills, the tools, the techniques to deal with this? And then during, here you are in that situation, can you pull those in and use those skills and strategies to help you cope? And then after, not just bouncing back to where you were, but having learned, having gained, having grown from that experience, and so bouncing back even further. And I want to share with you the 5 C's of resilience. So over the years, as I've worked with physicians and other healthcare professionals, at one point I looked at, the last 1,000 charts that I had and did some qualitative research on what helped people stay well. Either once they got better, what helped them stay better. And sometimes I would look at, and then I also added to that, in different situations where some people actually did well in a scenario that was quite challenging, right? What helped them do well there? And so I've come up with what I call the 5 C's, which is having, the first is C, having a sense of control, kind of reminding yourself what you can and cannot control and focusing on what you can. The sense of commitment, and that comes back to the, the passion, the why. What is your commitment to the work that you do? Why is it so important to you? And to stay committed to that, right? To stay focused and connected to the why, because there are lots of times where you're going to question what you're doing, and reminding yourself of that commitment on a regular basis is going to help you. The connections, we've talked about the people around you that are going to support you. And what we see are people who are resilient have caring connections. And not only do they have them, but they make efforts to maintain and sustain these connections in the long term. People who are resilient also have a sense of calmness. They know how to calm themselves down when they're upset. So not just and this relates back a little bit to the emotional intelligence. I talked about modulating emotions, that, you know, we can be in the middle of a crisis, but as a leader, how can we calm ourselves down to reassure and to support and to have compassionate leadership as we move forward? And of course, caring for ourselves, right? This is not something we do just under stress, but on a day-to-day basis. So it allows us then again to, you know, get up and do it again. And caring for ourselves seems like such a selfish thing to do, such a luxury. And I want to encourage you to reframe that from a luxury to an investment. That in fact, if you take a little bit of time and care for yourself, it actually allows you to be more available for everybody else that's counting on you in your leadership role, both in your personal and your professional life. And so, in fact, caring for yourself first is probably the most unselfish thing that you can do. And I want to just finish on this note about self-compassion. You know, I know we've gone through such a difficult time since the start of this pandemic, and encourage you, what I say, sort of reaching out and reaching in. So reach out to people around you, see how they're doing, let them know that you're there to support them, but also reach in, right? Reach in with kindness and offer yourself some compassion and warmth and care as you care for everybody around you, making sure that you offer yourself the same kind of kindness that you're sharing with other people. I'm just going to stop there and hope that we've got you thinking about some things and perhaps left us some time for some questions or comments.
Thank you so much, Mamta. This was a very, very inspiring talk as always, but I'm really grateful to you for this beautiful talk. I think I'll let Audrey-Jeanne start to look at questions, and I'll come back to you if I have if there's some time at the end.
Okay, thank you.
Yeah, thank you very much for your inspiring talk. Melanie Everson says so in the chat box, and also Peter Gates, Scott Brown. Awesome talk, thanks so much. So if you have any question, please feel free to type your question in the chat box, raise your hand, or just unmute your mic and say so you can ask your question. Is there anyone who has a question? Yeah, Caitlin has a question. So
good.
Hi, I'm wondering if you could talk a little bit about different types of leadership roles, because when I think of traditional leadership roles, it's not necessarily something that I see myself going into. I really like the on the ground work. And I just, when I think about kind of more traditional like leadership and management positions, it's not something I see myself striving for, but I still want to be able to have good leadership skills and use them in other contexts. So I'm just wondering if you could speak a little bit to what leadership might look like outside of sort of traditional, like higher up positions for somebody who wants to continue to do the on the ground work.
Yeah, Caitlin, thank you so much. Great question. Because, you know, you're absolutely right. Leadership is not just about that defined official role, you know, as head of something or CEO of something, right? So what I think, I think Kuz and Posner actually talk about, you know, leaders basically lead change. Right. So if you think about that, then every single one of us, right, has the opportunity and the ability to lead change in some way. And it can be in our personal lives, it can be in our community, it can be one-on-one with a colleague, it can be, you know, changing a process or the way that we do things. And of course, it can be leading a team, leading a group, and you know, much more administrative or management kinds of roles, as you've said. I think that to your point, a lot of us in healthcare actually find it hard to let go of our day-to-day work and take on leadership roles. And what I will tell you is that that's starting to happen differently. Certainly, you know, I've been in practice and I've watched things change over the last 30 years. And used to be that, you know, the leaders were very much disconnected from say, the clinical work or the day-to-day research, or that they really enjoyed. Now, what we're seeing is that it's possible to have a mix. It's possible to do both of that. And in fact, as you know, when you're early on in your leadership role, what we see is that there is a transition, and that the need to continue to do the work that the people you're leading do is important, because it gives you a bit of credibility, and it also gives you the ability to stay connected and empathize exactly with what they're doing on a day-to-day basis. What we're also seeing actually are now more dyad roles, so that you know, the clinician or the researcher can do the work they do, and then they're, you know, but they're paired up with an administrator who does more of the management kinds of stuff for the organization or the institution. So, you know, I guess what I want to tell you is that there are many different ways. And even if you never have a formal leadership role, you'll be leading in some way, right? And it's because, as I say, when you come back to the very basic definition of leaders lead change, you know, that's what we're all doing in our attempt to improve healthcare. Yeah.
Thank you. That makes me feel a bit more optimistic about it.
Thank you. Eric, do you want to take the mic?
Sure. Thank you. That was a great talk, Mamta.
Thank you.
I hope it's okay that a senior person asks a couple questions. I have two that I think is relevant for everybody. Okay. My first is that I guess the question is, when we're asked to lead frequently, we aren't told to scale back on other things. So I'm wondering what your approach to that is in terms of considering the time requirements for leadership roles and how to choose what to scale back, or I guess just emphasizing for the junior people that you need to scale back.
Yes.
And then maybe I'll ask my second question in a second.
Okay, all right, good. I was going to write them.
Yeah, no worries.
Save me. So Eric, the whole time management thing is so important, and you know, again, we could do a whole workshop just on that. So it is important, but I think even before we're looking at managing time, to your point, is recognizing just that you can't do it all. Now, also recognizing that we live and work in an environment in healthcare where people want us to do it all. Right? That we just don't have enough resources. And so if you can do everything you're doing and more, and you don't ask for time to do the new thing, then no one may necessarily offer it to you. So that's part of it. This is where I would encourage you to reach out to mentors and ask them, how are you managing this? But I think, you know, I encourage people to say, you know what, you want to think about, is this something I say yes to? Is this something I say no to, right? So, and part of how you decide that is if you had a sense of your purpose, as we talked about here, if you knew where you were going with this, then what you would want to do is to make sure that what you're doing aligns with where you want to go. Right? If it's something totally different, then perhaps it isn't the right thing at this time. I think that so that's part of it. Now, having said that, I also think, you know, somebody who started off in child psychiatry and ended up treating colleagues, although I do use my child psychiatry skills quite a lot with my colleagues, I do encourage you all to kind of be open to options and ideas and go with the flow, but it has to have some sense of interest, some sense of excitement, some sense of passion to this new thing that you're offering, and the sense of, I like this, this feels good. So part of it is just, first of all, looking at where do I want to go? Does this fit? And then, so what do you say yes to? What do you say no to? And also, you may want to think about yes and. Right? So there are times, and this is where perhaps what you're talking about, Eric, comes in even more, which is, yes, I can take that on, and I will have to look at letting something else go. Right? Or yes, I will take that on, and I'm going to need some support in terms of funding or administrative help or some other resources, right? So take some time to think about that in the yes and. I also, you know, encourage you, just because when you're asked something, of course, you never have to answer right away. So go back and talk to some people, go to your advisory group, ask people what, you know, what would you have liked that would have made it better. But, you know, probably the biggest commodity that is, you know, that we just can't keep creating is time. So it really is, do I have the time to take this on? And I would encourage you to, you know, always be looking at, can I protect time to do this in some way that's reasonable, that will allow me to succeed, right? What you don't want to do is take something on and set yourself up to fail right from the very beginning.
Oh, that's great. Thank you. And the second question is just about, I guess, what we're all, or a lot of us are feeling right now, that sense of languishing, that sense of blah, but and obviously it's worse, probably worse for most of us this spring, but it can happen anytime. And so I wonder how you recommend that leaders deal with, you know, that sense of blah, that maybe you don't have the energy that you did a month ago, and or you're more irritable. You don't want to take it out on the people who you are leading.
Yeah.
How would you recommend that leaders identify that and address it? I know it's probably a talk by itself, but quickly, I guess.
Yeah, it is. And I'm thrilled to hear that you are going to have something on resilience. So please go to that presentation with this question in mind. But, you know, so I want to say two things. One is that none of us at this stage in the pandemic are at our best. Right. So over the last 16 or more months, I have had the opportunity to work with colleagues every single day. And I've watched, right, I've watched sort of the different phases and how people are responding and how people are reacting. And there's several things. I mean, before we even came into the pandemic, many of us were experiencing burnout. The pandemic has actually only exacerbated that. And one of the signs and symptoms of, or some of the signs and symptoms of burnout is being more irritable, being more cynical, being more sarcastic, just, you know, basically running on fumes. And so that's part of it, right? The burnout has been exacerbated. Remember too, that not only are we feeling that, but we're in a workplace where everybody else is experiencing that too. So you don't have anyone else that, you know, has reserves to help you out at a time when you need it. I think the other thing that has happened through the pandemic has been this huge sense of loss. Right? We're all grieving. We're grieving normalcy. We're grieving a sense of control. We're grieving the way things used to be. We don't even know where they're going to end up. And then it was a lot of flip-flop, right? Things were open, then they were closed, then they were open, then they were closed, and we don't know what's ahead. You know, we think that third wave is settling in Canada, but, you know, there are these variants, what's happening with the vaccine, all of the unknowns. When we grieve, right, the first stage is denial. The next stage is anger and protest. So back to the irritability, some of our irritability is because we're grieving. And again, we're grieving many different things during this pandemic. And so there's all these layers of loss. And again, people around us are all at different stages of grieving and grieving different things at different times. And then of course, we've had some actual tangible losses as well throughout this. You know, there's so many reasons for this, but I just wanted to recognize, right? I think we need to just acknowledge that none of us are at our best. And so how do we deal with this? I think part of it is looking, you know, reaching out as leaders and just acknowledging, right, that this is not easy, being empathetic to it. The one thing that distinguishes empathy from compassion and compassionate leadership is, as a leader, looking at what you can do to act to make it a little bit better, right? So to be able to ask people, you know, is there something that would help you? Right? And can we do that? And so not just being aware of it and asking about it and showing empathy, but also being prepared to act to make things better. And I think for us personally, to look at, you know, again, being more aware that, again, I'm not at my best. And also that as a leader, I'm role modeling. Right. So I need to be able to say, hey, I'm going to, you know, take some time off this weekend, right? Or, you know what, let's just have a day in our department that, you know, on Fridays where we don't have any meetings because we're all Zoomed out. Let's just agree to that. Let's just agree that, you know, no one's going to email anybody after 4 o'clock every day. Right? And just start to think about what are some boundaries we can do in the workplace just to acknowledge that. And as a leader, if I can model the way, and I can say, look, I'm not going to send you an email, you know, Friday at 4, and I don't want to hear from you until Monday, that somehow we'll all survive the weekend. It'll be okay, right? And I think setting the tone to encourage that kind of behavior as well. right? I'm hoping you'll get lots of other tips in your presentation that's coming up. Thanks, Eric.
Thank you very much. We're running out of time. In fact, we're already busting. Richard, you want to ask your quick question with a short answer, please?
Yeah, sure. Like, it's a little bit around what Eric was asking as well. Like, where does our individual leadership start and end? And where does the system, which I feel is burned out as well, has a responsibility? You can only do so much mindfulness yourself before the system has to step in and take care of us.
Richard, I totally agree. I've come up with this this equation that says actually wellness or health is a product of individual and cultural and system level factors, right? And if any one of those are zero, we're just multiplying by zero. Right? So the reality is, it is a shared responsibility. I think that, you know, for the first 10 years of my career, nobody was listening. So I was doing what I could in my office, but now we are looking at what the system can do. And a lot of my work now is what I was referring to is helping to build compassionate leaders, not those that just say, yes, this is too bad, but actually feel empowered to act to make it better, right? And that's going to be at the systems level. You're absolutely right, Richard. And I think that, you know, we're hitting, I think, you know, that point where we're talking about it more, and that the system is going to be, you know, have to step up and make some changes. And there are some good articles I'm happy to refer you to afterwards. I appreciate the time that I've already taken up more time than you had for me, but I'm happy to follow up if you'd like and share some of those articles with you, thinking about the system level changes.
Thank you. In fact, we don't have any other talk after, so if you want to, we can take a couple of minutes again for other questions if you are willing to.
I'm here.
Okay, yeah. So Sherry had a question. Do you want to take the mic, Sherry, or want me to read your question?
Go ahead and read it. I think it's pretty straightforward.
Okay. Perfect. So with the paradigm shift moving toward cooperation, interdependency, and collaboration, how does this fit into our granting agencies and academia evaluate the leader in 2021? Does it have to be a senior or first, or does it have to be a senior or first order? How effective is co-leadership?
Yeah. So, you know, Sherry, thank you very much. And I think this segues very nicely from Richard's comments about the system level, right? So this is the system in which we work. And as we're talking, you know, and part of the system are the grant agencies, part of them are the academic departments and policies and procedures that look at promotions. And so, you know, does it have to be senior first author? I think it's a good question. I'm certainly not, I think, the most qualified to answer that, but I do think that co-leadership is going to be, and co-leadership and co-authorship is going to be very important. But what it might take is, you know, a determined group of you to start advocating for that, to start saying, you know what, and because we've seen, and again, if I just look at, say, authorship, you know, and I talked a little bit about, does gender matter? The reality is we saw that, you know, through the pandemic, our male colleagues were much more, you know, had much more publications and took the time and the opportunity to do that. A lot of our female colleagues, you know, not just were working from home, but you know, were homeschooling and taking care of elderly parents, and, you know, the housekeeper's not coming in if you had one. And so, you know, just actually had more responsibility. So I do think that it's going to be a lot about recognizing and lobbying for changes in some of these areas, including granting agencies and promotions processes.
Glad to hear you mention the word lobbying, because yes, this question was actually to try to encourage the audience to really raise these questions and to point out the paradigm shifts that you so eloquently spoke of, so that we can pave the way for the next generation to be recognized for all their strengths, because leaders can be found in places that traditionally the people making the decisions weren't used to looking.
Yeah. Yeah, thank you very much, Sherry. I totally support that.
So our last question will be from Maria.
Yeah.
Thank you, Audrey, and thanks for a great talk. I just want to ask, maybe just reading so we don't take people's time answering the question, but some reading on mentorship, because we as junior scientists are having mentors around, but we started to mentor other people coming along with us. And I always get worried about giving too much advice versus asking the right questions for people to find the right answers. And that comes from my experience of having strong mentors giving me advice that didn't apply to my circumstances and took me a long time to figure out that it was not me who failed. It's just that that advice didn't apply to me.
Yeah. Yeah. So I really appreciate that. And, you know, I think so there's two parts here, I think. One is realizing that when you have a mentor, remember I said that almost by definition, they're just telling you what they did, right? And they're trying to give you the benefit of their experience. So, you know, part of this, I think to have a successful mentoring relationship, it is partly up to us as a mentee to be prepared, to be clear about what the question we want, what is it that we're moving towards, and what do we need some help with. And so, you know, and not just for you, Maria, but everybody on this call, because at different phases in our career, each one of us can be a mentor and each one of us could use a mentor, right? So I think that when you have an opportunity to look for a mentor again, to think of, you know, am I clear about what I need from them? Am I clear what my ask is? Because I think the more prepared we are, which usually doesn't happen early in our careers as well, the better we're going to get from them, right? So I think that's important. To your point, Maria, about being a mentor and how can you not just, you know, give people advice that might take them down a different path or take them a while to figure out. I'm going to teach you a little bit of coaching. That's a good maybe I'll teach you that before we wrap up today. There are many different ways to coach. I'm a certified coach and coach, you know, a lot of senior physician leaders, but we can all coach in whatever area we are. And I would encourage you, anytime you have somebody asking for advice, somebody junior to you coming, just have a coaching conversation. So a really good model is the GROW model. So GROW. So the G stands for goals. And so I had said to you, you know, it's good for a mentee to identify what their goals are before they even come in. But if you could, as a mentor, use the GROW model, the G is clarifying the goals. So to say to somebody, you know, where are you hoping to go with this? What would you see as, you know, success, right? Helping them identify. And so it's really powerful questions, just asking the questions, not telling them this is where you need to go, but where would you like to go, right? The R is reality. So what's the current reality? Where are you now, right? You know, what stage are you towards that? The O is obstacles and options. So what's preventing you from getting there? What's preventing you from doing that right now, right? Or what different opportunities or options do you have to move in that direction? And then the W is the way forward. So partly it's, you know, it's just really identifying the next step for this person and to be able to say, what's one thing you could do to help you move towards that, right? And there, in 4 questions, you have a really powerful conversation. And although we call it the GROW coaching model, you know, as a mentor, I would totally encourage you to pull that out. And what it does is make sure that we're on the same page, right, to your point. Okay.
Thank you so much, Mamta. This was a beautiful discussion that we could have kept going, but I think we'll have to thank you and wrap up for this session. So again, warmest thanks to the audience also for being present, for assisting to this talk. Just as a few little things, we're going to reconvene tomorrow at noon Eastern time. So just check your time zone to be sure with team research learning program and mentorship. So there's going to be a session on mentorship and a session on TRLP, so you can choose whichever session you want to join. So I wish you all a very nice afternoon. It's very hot here in Montreal. I suppose it's hot throughout Canada. So enjoy the sun and the warm evening, and we'll see you all tomorrow. Thank you, Audrey-Jeanne, also for co-chairing with me.
Thank you.